I'm Dr. Ashokan from TAGORE Dental College. I am going to present a topic on case history taking. Case history is very important for the diagnosis and treatment plan for the patient. Always listen to the patient. They might be telling you the diagnosis by William Asner. What is case history? It's a clinical procedure in which there is a dialogue between patient and the doctor regarding the disease. When you're asking the questions, you have to ask gently. First, you have to ask patient station number, date, name. Then after that, you have to ask age, sex, address, and occupation. First three, it will give what time of patient will admit. Then it will be useful for further contact. Coming to the age is very important. Why age is important? Because some disease occurs in younger age group, some occurs in middle and older age group. So, in coming to younger age group, pericognitis and dentigerous cyst are more common. What is pericognitis? It's an inflammation of pericognal flap covering the partially erected tooth. And dentigerous cyst is normally occurs in the unerupted permanent tooth or unerupted supernumerary tooth or impacted tooth. Both will seen in the younger age group. Then middle age group, aphthous ulcer and gingivitis is more common. Aphthous ulcer mostly seen in the mobile mucosa, mostly seen in the labial mucosa, buccal mucosa, and tongue, lateral part of the tongue. Gingivitis seen in middle age group. Then periodontitis and carcinoma, they are more common in older age group. Coming to the sex, attrition and leukoplakia, they are more common in males. What is attrition? Wearing of teeth due to physiology. Then after that, leukoplakia is a white patch, homogeneous or non-homogeneous patch seen in the buccal mucosa or labial mucosa. It's a pre-malignant lesion. And also squamous cell carcinoma and smoker's palate, more common in male. Male have more habit of smoking, chewing like this. So smoker's palate and squamous cell carcinoma more common in males. And iron deficiency anemia, these committed gingivitis, after ulcer, pregnancy gingivitis, they are more common in females. In iron deficiency anemia, there is a depapillation of the tongue and red coloration seen in the dorsal surface of the tongue. In descommitted gingivitis, there is a gingival desquamation and a redness seen in the marginal and attached gingiva. Pregnancy gingivitis occurs in the interdental papilla. There is a sessile or pedunculated growth seen in the interdental region. It's soft in consistency and reddish in color. And after ulcer, it is seen in the mobile mucosa. And occupation, you have to ask the patient occupation. Why occupation is important? Some certain diseases are more common in certain people who are working in certain jobs. And Bertolini lines, Fascija, and Taylor's nuts. What is Bertolini line? Bertolini lines, there is a bluish pigmentation seen in the marginal and attached gingiva. It is more common those who are working in the press. Okay. Then after that, Fascija is seen in the people those who are working in the match factories. Okay, match factories. Then tailors nuts. Normally, tailors keep the keep the pin in the central incisors. So there is a notch in the upper and lower anteriors. That is a central incisor. So that is called as Taylor's notch. Then chief complaint. You have to chief complaint should be in the patient's own words. Okay, you have to ask according to the chronological order also. So you have to ask when is the disease starts, what is the progress of the swelling, what's the severity of the swelling. You have to ask. When you're asking the patient history, you have to ask whether the pain or swelling develop. Okay, or any growth order. And patient also complains inability to open the mouth. Okay, so you have to ask all the things in a chronological order. Suppose if the patient complains of pain, when it was started, all the things you have to ask. Instead of personal illness, you have to ask mode and cause of onset, duration. Modern concept, normally you have to ask when was the pain started, whether the pain or swelling, which one start first. Then duration, you have to ask for the past how many days you have the complaint. Then when you're coming for pain, you have to ask whether it's a pain is continuous one or intermittent one. Then intensity of the pain, you have to ask whether it's a mild, moderate, severe intensity. The nature of the pain, it should be throbbing like pain, or shooting like pain, or shock like pain. So you have to ask which type of pain patient have. Then you have to ask whether the pain is radiating or referred to the adjacent area. Then you have to also ask aggregating factor or relieving factor. Some patients will tell the pain will increase during night time. Some patients they will tell pain is increased during mastication. So you have to ask what are the aggravating factors and the relieving factors. Then coming to past medical history, you have to ask patient past medical history about diabetes, hypertension, asthma, drug allergy, cardiac disease, bleeding disorders, and alternative medication. In diabetes mellitus, patient will, patient will produce oral manifestation. When you're asking the patient history, will easily come to diagnosis. Then hypertension, you have to ask proper history. And asthma, some drugs are not prescribed for asthma patient. And you have to ask the patient drug allergy. If the patient giving history of allergy to amoxicillin, then you have to give alternative history of medicine. Then coming to the cardiac disease, you have to ask any past cardiac surge, past cardiac disease, or myocardial infarction like this. They give and patient. You also have to ask whether the patient is taking any aspirin like medications. Then bleeding disorder, you have to ask whether any bleeding disorders he have or any other family members. Then patient take any alternative medication like Siddha, Ayurveda, and homeopathy. You have to ask any alternative medical history also. Past surgical history, you have to ask any previous past surgical history. And past dental history, you have to ask whether the patient is undergone any filling or extraction before that. If the patient is undergone any extraction before, you have to ask whether the extraction is a complicated one or non-complicated one. Then coming for personal history, you have to ask the habits. In habits, you have to ask diet, whether it's a vegetarian diet or mixed diet. Oral hygiene method like brushing, how many times he is brushing, what type of material he is used for brushing. Then after that, oral habits like if the patient is a child, you have to ask either thumb sucking like habit. Then when deleterious habit, when the patient is an adult patient, you have to ask any deleterious habit like smoking or tobacco chewing. When the patient gives history of smoking, then you have to ask what type of smoking he is having, whether he is having habit of cigarette or habit of BD. Then you have to ask how many packets per day or how many cigarettes per day. Then how many years, how many months he is having this habit. Then coming for tobacco chewing, you have to ask whether the patient have habit of chewing, pan chewing or tobacco chewing. If the giving history of tobacco chewing, you have to ask what type of tobacco products he is using, whether using betel nut, betel leaf, or betel nut, betel leaf, and betel pit. Okay. Then marital status, you have to ask whether the patient is single or married. Then you have to ask the patient history of any consanguineous marriage. Then family history is very important because if you're asking the family history, it will give clear idea. Okay, some diseases like amelogenesis infecta, dendrizogenesis infecta, it will also siblings also will affected. Okay, so it will produce discoloration of both deciduous teeth and permanent teeth. And some patient, when you're asking the patient history, sometimes they will give the siblings also have some bleeding problem. So you have to ask the proper history of bleeding. Then coming for clinical examination, it will be into general examination, systemic examination, and local examination. General examination, you have to note down the appearance of the patient, and you have to see built and state whether it's a moderately built or ill built, or like this. Okay. Then deformity, any scoliosis, kyphosis, like this. Then nutritional status, well nourished, ill nourished, or moderately nourished. Then you have to check vital signs like BP, uh, pulse rate, and respiratory rate. Okay. Normal pulse rate is 70. Average pulse rate is 72 per minute. Average respiratory is 12, 14 to 16 per minute. Okay. Then you have to also check any clubbing of fingers, and you have to check any paleness seen in the palpebral conjunctiva. In systemic examination, how to compare CNS, CBS, respiratory system, GIT, GUT, and musculoskeletal. In central nervous system, you have to ask any history of any headache, vomiting, like this. In cardiac serious, you have to ask any palpitation, breathlessness. Then a respiratory system, you have to ask any difficulty in breathing, all the history. Then GAT, you have to ask any gastritis, or any gastric ulcer. Genitourinary system, you have to ask whether the patient have micturition is normal or any burning sensation during micturition. Then musculoskeletal, whether the patient have any habit, any pain in the joints. Then coming for local examination will be extraoral, TMJ examination, and lymph node examination, and interval examination. Extraoral examination, you have to see the patient, any facial asymmetry is present. Okay. If any facial asymmetry is present, you have to note down the patient facial asymmetry. Then you also see if there any swelling or ulcer, sinus or fistula opening, or scar formation seen in the face or neck. In TMJ examination, you have to ask that you have to check whether we have to ask whether any pain in the TMJ. Then you have to palpate on the TMJ and elicit the tenderness and palpation. Then ask the patient to open the mouth. Then you have to check the jaw movements like retroussive, lateral movements. And you also have to check jaw deviation, any jaw deviation. Okay. Then after that, you have to check any clicking sound, either felt or audible on TMJ. Then lymph node examination, you have to note down all these following finds when you're doing lymph node examination. Right side, right side or left side, and side, which group of lymph node, either submental, submandibular, then posterior auricular, preauricular, like this. Then shape of the lymph node, roughly ovoid in shape. Then size of the lymph node. Then number, whether it's single or multiple. Then consistency, whether it's soft in consistency, firm in consistency, hard in consistency. Then tenderness is a mild, moderate, or severe. Then you have to check the either lymph node is mobile or fixed one. Then interval examination, it will be divided into hard tissue examination, soft tissue examination. Then after finishing all the exam, all the history and clinical examination, you have to come for summary. In summary, you have to note down the positive finding. Okay. In first summary, it have four paragraph. Okay. First paragraph, you have to note down patient name and the chief complaint. Second paragraph, you have to note down the history of presentness. In third paragraph, you have to note on the positive finding during clinical examination. And last paragraph, it is a conclusion. After correlating all the history and clinical finding, you have to come to conclusion. Then provisional diagnosis. All the taking history and clinical findings, you have to tell the provisional diagnosis. Provisional diagnosis is based on the patient chief complaint. Then after that, you have to note down the other diagnostic condition. Other than patient chief complaint, you have to find out the other diagnostic condition, and you have to decide the treatment plan accordingly. Then you have to give differential diagnosis. The patient complains of pain, you have to give differential diagnosis for the patient complaint also. Then you have to send the patient for investigation. Investigation may be blood investigation or radiographic investigation. Blood investigation, routine blood investigation, and radiographic investigation like IOPA and OPG. Then after that, final diagnosis. After doing all the investigations, correlating with the provisional diagnosis, you have to come for final diagnosis. Then after final diagnosis, you have to plan the treatment. Then we have to inform the patient according to the treatment plan. Thank you all.